What's up, y'all? Welcome back. And this is a very important topic that has not only taken precedent in the last few years, but man, it is on every broadcast, including how much we are seeing it with the Stanley Cup Finals in full swing and also the NBA Finals. John W. Ayers is the Vice Chief of Innovation in the Division of Infectious Disease and Global Public Health. He has a lot of other titles that he does not want me to read to you, though they are very damn impressive. And he was a part of a very important study on the effects of sports gambling addiction and how it is a public health crisis. So first off, John, thank you for joining me. I really appreciate it. Let's just dive right in. Is it true, as you told NPR, that this sort of idea for a study came to you on the golf course?
Yeah, that's actually true. I was at the golf course and one of the cart boys, he's like, "Hey, can I borrow some money?" And I'm thinking, like, dude, when I was 16, I wasn't working at the fancy country club. You should not have money problems. I'm not trying to figure out like what's actually going on here. And he's like, "I've had some bad beats." And I'm thinking like, "Oh, he's gambling on the golf course, normal golf course stuff." And he's like, "No, no, no, I'm just getting killed on the apps." And he was talking about sports betting apps. And so here we live in California where sports betting isn't even allowed. Clearly, this person is not of legal age in states where it is legal to gamble on sports. Yet he was gambling on sports and facing a financial crisis because of it. Clearly, some form of addiction was happening. And it really woke me up to the idea that this problem could even exist. And it made me go look to see, well, is he just a lone example or is he part of a broader pattern? And we ended up discovering that actually his experience was part of a growing trend across the nation, something that continues to grow even today.
A humongous problem, obviously. How old was he? And if you don't mind me asking, just to give the audience an idea, how much money was he asking?
He's asking for a few $100s, and which is, a lot of money to a 16-year-old. I guess with inflation, maybe it's less, but he was around 16, I think, is what I would guess. 16.
Mm-hmm. Yeah, incredibly troubling. Okay, so your study that was published by in the JAMA Network, of course, and UC San Diego, there was a piece that was titled "Study Reveals Surge in Gambling Addiction Following Legalization of Sports Betting." Y'all looked at and found a dramatic increase in sports betting and gambling addiction, help seeking as well, since the 2018 Supreme Court decision. You say, and this is a quote, that public health experts paid little attention. Why do you think that is?
Well, we're in public health, we're very oriented around our prior beliefs. I think any listener to this would know that during COVID, that revealed our inability to pivot and respond to new and emerging issues. And that was particularly true of things like gambling, where it's not in our radar. There's no active surveillance of how many people are being diagnosed with gambling addiction. There's no act, it's not part of any annual major public health survey or we're actively monitoring these trends. Instead, it's kind of always been on the side. And why has it been kind of on the periphery? Well, it makes sense, right? I mean, historically, gambling was, localized to small communities like Atlantic City or Nevada, particularly Las Vegas, and it was be isolated there. And so it was a local or regional problem. And that's certainly not the case anymore with sports books. And so when sports books came along, nobody was thinking about the public health cost offsets of it because it was not as it wasn't a policy that went through broad legislation and was widely debated. It was a Supreme Court decision that, de facto made sports betting legal across all 50 states, where now every state could decide his or her own policy. Um, that said, we weren't aware of what the potential cost offsets were. And I think that was indicative in a lot of the ways that states themselves legalized it. So let me step back and say two things about this. First, like public health should be driving part of the conversation, helping identify areas of concern and areas that need to be monitoring. And we didn't do that with gambling addiction. And that failure had these cascading effects across the sports betting architecture. If you look, every state that's legalized sports betting, only one state, when they legalized sports betting, even considered the public health consequences of sports betting. That state was Wyoming. And they set aside a whopping $300,000 to spend on public health resources to address gambling addiction. Uh, that's a tragedy. And clearly, no one had any thought that this issue could be emerging and that the issue could be growing. And so, as a result, we had to think, well, how do we even study something where there's no resources around it to study it? It's not part of ongoing monitoring. It's totally excluded from the literature. And so we had to use a shortcut. And where do people go to get help? Well, they go online, they go somewhere like Google. And so we actually monitored internet searches to Google to understand trends in people's potential addiction to gambling and how that's changing over time. And depending on where they live, the legalization of sports books in their state.
And tell me also, what did you find, and what was something that maybe going into this study you did not expect to find?
I certainly didn't expect to find what we did find. And ultimately, what we found is if you look on Google, millions of people are searching for gambling addiction help seeking. They're exercising searches like help with gambling addiction, gambling addiction help groups, these types of searches. We're not identifying someone who's talking about a problem abstractly. We're directly observing people who have been harmed and how, in a moment of desperation, they're searching for help. And what we found is not only does it going up nationally at record levels and continues to break record levels almost each and every month, we found that you could look at states where it was legalized. And you could see that when a state legalized sports betting, there was a statistically significant increase in internet searches for gambling addiction almost immediately. But in states where it was legalized online, where you could gamble on your phone, it went up even more. And so you could see that stepwise pattern where a state would legalize sports books, brick and mortar sports books, and they'd be an increase and they continue to rise. And then they would legalize online sports books and it would increase yet again another step and then continue to rise. And so we could expressly see like how this was a phenomenon was driven by the specific policy, not an overall trend. And of course, it's a state issue, but it's also a spillover issue like I talked about with the young gentleman here in California.
There's a really important point that I think is not talked about as much, which is there are sports books in stadiums now. Wrigley Field has added a sports book. I'm seeing that. I'm blanking. It's either the Capitals, Washington Wizards. I believe they share the same building, but there's going to be a sports book added there as well. What you have painted to me is access, how easily accessible all of this is for folks to potentially, and a lot of times, become addicted. So what role do the teams have in all of this, in your opinion?
Well, I think it is an access-driven issue, right? And you're talking about brick and mortar phenomenon. Of course, that plays a huge role. I mean, we all know what the New Orleans Saints play. That's now known as the Caesars Dome instead of the Mercedes Dome, and so it's become ubiquitous. The phenomenon of sports betting, and now leagues and teams will have their specific sports betting arrangements where they'll be partners with sports betting organizations. And yes, that's fundamentally a problem because it is seeing where we're actually having a predatory nature where you can stay or do anything, but that's also true on your phone. The big problem with sports betting is that you can now gamble on your phone remotely. You can be totally isolated, never have the help you need, and have the impact of what's happening to you without anyone surfacing that the problem is occurring. And so that's really the big issue. And I would say too is like we haven't even talked about this yet. Is like we think of this as like states legalizing it, but we also allow for legalized offshore sports books to operate in all 50 states. So you can live in a state where you've decided, your legislators and you as a community decided we don't want this, like a state like Utah, but then offshore sports books can exist and operate in your state and reach everyone on their phone.
Mm-hmm. I want to go back to the team aspect for a second because I just personally, as a member of the media and also as a heavy sports consumer, one thing that just really gets me is seeing in predominantly European soccer, the main advertisement on their kits are sports books. And then seeing, now that I'm thinking about it, another what feels like to me a conflict of interest is a company like ESPN, who is going to
Yes, you
have
bet.
acclaimed sports journalists, award-winning sports journalists, but they're also in charge of information, and they
Hmm.
have a sports book as well. So
Hmm.
how do you see all of this as a researcher who looked into this serious issue?
Well, I think Pete Rose must be rolling in his grave, right? I
Oh yeah.
mean, to see that gambling was something that was shunned, we would never want to denigrate, the merits of sports with gambling. And now once there's money to be made and money to be made legally, well, everyone wants in on the cash. And I think it reminds me of a time where we have this over and over again, where things that drive public health consequences or drives addictions, they often we go for the money first instead of being pragmatic and setting aside and thinking about it. Like, doesn't this remind you a lot about how doctors in the 50s and 60s and 40s would talk about their favorite cigarette,
Mm.
the healthiest cigarette? And so, now you can have what's ESPN's favorite place to make sports bets? What's their number one thing you should bet on? And so that's what it reminds me of, is like tantamount to how, money is driving, money and, through corruption, it's the great corrupter of many things, is driving people's to make decisions from rote sports betting this way. And there is no offset to that. I mean, it's pervasive how this industry will say or do anything. I think you saw like an example of that. You're talking about the potential of like ESPN and like their reporters to say things or behave differently because of sports betting. Highly plausible, but the reality of it is like there's already a recognized pattern of deceit from the sports betting industry. Look at DraftKings, right? They used to run advertisements called risk-free bets. You can't lose. Well, how's that possible? You can't lose. Like, if someone thought about that for any moment in time, they'd be like, that's not true. And those ads don't exist anymore, but not because state regulators stepped in, not because public health advocates, but because of a class action lawsuit where consumers themselves had to advocate for that type of advertising to be limited. The reality of it is like anyone can participate in the sports betting market from a legal framework, and they can say or do practically anything. And that's the real danger here, is there's actually no offset, no counterbalance to trying to address these from a public health standpoint. And it's I can tell you many anecdotal examples. We talked about the kid who motivated me to do the study. Well, the reality of it is once I read about his story, one of the first things I read when I started looking online about this was about a gentleman. I think he was in your neck of the woods, Rick. I think he was in Illinois. He was gambling on sports, liquidated his entire life savings, and they had a concierge team working at his mobile sports book who would call and tell him how to apply for online credit cards so he could continue to gamble. Knowing he was broke, knowing he had this problem, knowing he was hiding this from his family, as was revealed in court cases, actually helped him apply for credit cards. It sounds like something out of a Martin Scorsese movie, but actually, this is the way sports books operate today, because we're not doing anything to make them accountable of the potential consequences. And if there's money to be made, you better believe that people are going to do things and behave in a unscrupulous way to try to get that money, as they did with that particular gentleman, and as they did with all of us advertising things like risk-free bets, something that clearly doesn't exist. And I think in that court case that went on, I think it was less than 3% of people who used DraftKings had ever actually withdrawn any winnings. Not that they were winners, but they ever withdrew any winnings. The norm is everyone loses.
Yes, absolutely. Good point. One other thing that I saw was in a Vice News video where they talked about how this is someone who they say has a mask on, said that they worked for one of those companies, and they would target people who continue losing, and they would keep following up with them, offer them to become a title of a VIP user.
Mm-hmm.
Hey, you haven't used blah, blah, blah credits that we offered you. How about we double it? Is it a stretch to label these companies predatory?
No, it's certainly not. I think I used the analogy of Martin Scorsese. I think that's true. There's very little difference between the characters that Joe Pesci or Robert De Niro portrayed and the way a lot of these companies behave. And they're doing a quote bust out, right? they're constantly seeking and working with these concierge teams where they build this infrastructure to act in that way and to go after these consumers in a predatory way and make them yield, many expenses. And the reality of it is like, what can we do about it? And there actually are frameworks that we could do to resolve these types of problems. It's just here they haven't gotten a lot of attention, but in other jurisdictions internationally they have, and we can talk about some of those. One of those would be like, you can't gamble on credit cards.
Hmm. Interesting. What else could you add to that?
I think, from a public health perspective, we have a lot to lean on here, both from other examples and examples in the industry. I think one, we need to, you know, if you break it, you bought it. Sports books ought to be responsible for remediating some of the damage that they do cause. And yeah, for some people, it's a fun bet or two, but for other people, it's life altering and they're damaged and often damaged beyond repair. What do we do to prevent that from happening or, if possible, remediate that? And I think they should be paying more and more for this. A bigger percentage of the revenue should be spent on directly on trying to communicate to people, trying to make resources available to people, investing in understanding the problem and how to respond to the problem, and having a public health perspective on the problem. I think that's the one big thing we can do. And clearly, that's not being done. As I told you, like Wyoming, dedicating $300,000, and other states that maybe don't document the dollars in their legislation, where they do it as part of their general budget. They do so as a percentage of like less than 1/10,000th of a percent will go to actual public health issues around gambling. Most of it just goes into the general fund, and we're just eager to have that money and spend it. That's one thing we can do. The second thing is we can regulate how these things are marketed. I just gave the example, the analogy of like, this is a lot like doctors telling you their favorite cigarette when ESPN and other organizations are telling you, and athletic groups, et cetera, are telling you this is our preferred betting. Maybe there'll be rules about some separation between the two. There'll be rules on what you can claim or cannot claim, rather than these being legislated through civil courts. There could be regulations around it, like you can't make claims about risk-free bets. I would say the other thing is like maybe reducing access in some way. Maybe should we even have mobile phone betting at all? And if we do, could we mimic some other countries' safeguards? Other countries will have betting limits that you can do on a mobile app. The absolute volume of money you can bet, and also the absolute number of bets you can make. And they'll actually enforce time out periods where the app will not be available to you for reasons to preserve your safety. And clearly, that might adversely impact some people who are just like, well, for me, it's not a big issue. I'm gambling, a tiny fraction of the resources I have, and it's worth the fun. But for other people, it would protect them. We can enforce things like that around mobile betting. And then I think the last thing we can do is create a infrastructure to actually help these people. When you go look at like what to do about gambling addiction, we don't know very much about it. Instead, a lot of what we do in clinical practice and a lot of what we do in public health is, well, it's kind of like X, it's kind of like Y. Why don't we just do that? And we'll try the same technique. And so, or, like gambling addiction services, like we don't think about how to talk about it. The reality of it is like, it's an issue like if we raised awareness and people were aware and actually confronting their friends and loved ones, we could help them and help them sooner. And so bring some daylight to this issue so people know that they can and where to get help, and that we develop the evidence so they get the best help possible.
I guess I'm just curious on the flip side, these companies are ruthless. All they care about is a positive image and their bottom line. So if they were to potentially give it like the timeout thing, I could never see a Fanatic Sportsbook doing that because it
Yeah,
means less money for them at the end of the day.
that's
Even
right.
if people lose their lives, lose their houses, lose their car, they don't care because they get
Yeah.
those funds. So how do we potentially, if it were to happen, shrug off how many of these companies view their bottom line and try to help the very people that made them insanely rich?
It's going to be through regulation. No one's going to volunteer for for this to happen. We oftentimes companies will tell us in industry over industry that's related to health and public health over time, they'll tell us, trust us. We're close to this issue. We will do the right thing. And then they never. You have to force them. And so, that's why agencies like the Food and Drug Administration exist to regulate, drugs and biologics that we use in healthcare. That's why there's actual legislation around, you have the Center for Tobacco Products that is part of the FDA that was actually, legislatively mandated that we would invest in how to spend these resources and how to be aware of problems and create rules that would reduce harm, but do so in a way where it's proven effective instead of just, whack-a-mole and trying 10 or 12 different things. We'd actually use strategies that work. We have to force their hand. And so what does that mean? That means listeners and viewers here need to go out and advocate for reforms. If you live in a state that has legalized sports books, you need to be advocating for regulations that reduce their danger to some large subset of the population. And then if you live in a state that doesn't have it, you need to make sure that any legislation that would allow it, well, first, is it worth allowing? That's, a value decision. I can only tell you about the cost offsets from public health perspective. But then if you do allow it, you need to have clear safeguards there, like, resources, reducing access, et cetera, to make sure people have a safer experience. I mean, listen, I'm no public health nanny guy. I do a lot of things that are bad for my health. I love Coke and pizza. That's clearly
To
not a
clarify,
great thing for
Coca-Cola.
me. Coca-Cola, yeah, I love Coca-Cola and pizza. So it's clearly not a great thing for my health. I don't need a nanny state to say I can't have Coke and pizza. But you know what? We don't allow Pizza Hut to advertise themselves as a therapeutic, to claim that it's a healthy product and it's going to increase your longevity and cure cancer. And we don't have a magic app that can just produce pizza right there where you're at. And so we do have safeguards in place, and we don't when it comes to sports books.
I'm just curious. I'm curious. What's your favorite kind of pizza?
Well, I'm going to go John's and Bleecker. I like that.
John's and
Probably the best
Bleecker?
pizza. Yeah, John's on Bleecker.
Oh, John's
It's in
on
the
Bleecker. Okay.
yeah in the
Okay.
village, and I would say in California, I'm going to go. Oh, uh, Moza, Nancy Silverton over on Melrose and
Mm.
La Brea
Mm-hmm.
in kind of just by Hancock Park.
Oh yeah,
That's
I
a
used to live right over there.
that's a
Um,
great that's a great pizza. But I don't think Nancy would say it's good for me.
no, definitely not. There's also a great barbecue place over there as well. Um, I'm gonna think of it and I'll get back to you. But there's a phenomenal barbecue place over there on La Brea. Going forward, your co-author David Yang said, despite gambling addiction as a recognized disorder in the Diagnostic and Statistical Manual of Mental Disorders, it remains largely overlooked in healthcare and public health with no formal ongoing surveillance. Without systemic surveillance, we are flying blind while millions bet on sports. What sort of surveillance is he talking about exactly?
We don't even know to ask people. So when you come into a clinic and you have opiate addiction, I know signs and symptoms to look for. You're going to have puffiness in the face. You're going to have certain, features, and I'm going to identify those, and it's going to prompt to ask about it. But when you have a gambling addiction, it's hidden. You know, your credit card statements aren't stapled to your forehead. You can do this all alone. People might not even know about it. Your wife, in many of these court cases, we see like the wife doesn't know or the partner doesn't know what's going on. And it's entirely hidden from them because you can do it on your phone. And so it doesn't even get brought up. And the first key to getting help is problem identification. And if when you come into the ecosystem where you can get help, like healthcare, because it is a specific diagnosis, and there are techniques that can be used and routines that can be used to help treat gambling addiction. If it doesn't come up, then you're never going to get help. And so what he means is we need to invest in surveillance to identify who has the problem, when, and where. And that can mean several things. That can mean in the clinic that we educate the clinical workforce to bring up these issues, because I bet you they don't bring up these issues. Maybe for like a 23-year-old man, maybe instead of bringing up your fifth COVID booster, we should be talking about gambling addiction way more often, because that
Mm.
might be a much higher prevalence and bigger cost to you. Um, then outside of that system, how do we identify people and monitor and public health monitoring, identify the problem and to identify what is addressing the problem? We had to use a surrogate, internet searches on Google for gambling addiction help seeking. Clearly, we need to have something where we can estimate the prevalence. And that's something interesting. Is like the gambling industry. I once did a interview, and they had a representative from the American Gambling Association was on, and he was like, "Well, John, it's less than 1% of people have the problem." And I'm thinking like, 1%. We're talking about 3.25 million people have a really serious problem.
Right.
Like that's a huge issue. I mean, what percentage of people get lung cancer from smoking? It's going to be less than 3.25 million people. Yet we changed the entire regulatory framework to address those people. What if it's higher? He's just pulling that number out of his butt. Like he doesn't know. And so we need to invest in those resources and know like what is the prevalence of gambling addiction, and knowing that we can then know what interventions are working. We want to have evidence-based public health and evidence-based medicine. And the first starter to that is identifying the problem and surveilling the problem.
Do you have any hope that that'll happen?
I think it could, um, but I think I sadly will say that I think it will take far too long and too many people will be hurt before we deal with the problem. Totally unrelated to this, I'll tell you a funny story.
Okay.
I'm the guy that said e-cigarettes are going to be a problem. That's me. I was a little kid then. And I remember watching a story on 60 Minutes and Leslie Stahl's talking about snooze pandemic. And I'm like, well, I grew up working in the tobacco fields. I know a thing or two about tobacco. I've never heard of snooze. What the hell is snooze? And so I'm looking around and I'm like, yeah, I never like this. I'm looking for data and there's no data on like if it's popular or not popular. And she's talking about we're spending tens of millions of dollars on this snooze pandemic. And I go on this deep, rabbit hole, and I go on Reddit and I find this thing called electronic nicotine delivery systems. We didn't call them e-cigarettes then. And I find that they're really popular online. A lot of people are talking about them on social media. A lot of people are searching about them on the internet, and way many exponentially more times than snus. And I remember I sent this to like one of the top medical journals, and the editor of that journal, she goes, John, my gut tells me this isn't true. And that's the reality in public health and a lot of what we do. It's our gut that leads us and not the data. It took a gut wrenching experience of hearing a young man that was having a problem to motivate me to then go look and see if it was systematically a problem, and discovering that it was a systematic problem and it was much bigger than I ever anticipated. But even when we have the data, too often we go, but my gut tells me the data, but it's only 1%. But I have my husband, he bets all the time, has fun with her. My daughter, she likes him, it's fine for her. Like, we need to move away from these experiences and move towards data. And I think that's going to be our biggest barrier here, is having a data driven response. And, we want to say that where the data are now, and where the data are now is we see millions of people searching online for help in desperation. And that number is continuing to increase. How many more millions must suffer before we do anything?
I'm curious, have you kept track of any Congress people possibly touching on this, bringing it up with legislation, coming to the House floor? Has any politician, brought this up in your recent memory?
Not in my recent memory from a federal standpoint. There has been some federal movement on trying to regulate offshore gambling sports books,
Mm-hmm.
but not for the reason that they exist in states that may not want it, but because they're directly competing with companies like DraftKings or ESPN Bet, et cetera. Um, so it's more of a preservation of the market. I think there's some representatives out of Utah, for obvious reasons about the culture there, have been, more outspoken about sports books, but it definitely hasn't received any of the attention you think it would have. And certainly since our study, uh, which I mean, we're talking about it now, it's been talked about literally everywhere. I think there was some broad awareness of the problem. I don't think our study as of yet has motivated any legislative reaction.
Yeah, it's a bummer. From a sports consumer perspective, this is just my own personal 2 cents, working in the space for quite a while, working for a few different networks as well, seeing how much it is just in your face. Even during the Stanley Cup playoffs, not even as a commercial, but as a channel where they had an alternate broadcast that was showing betting odds for the line that was on the ice, their betting odds of scoring or assisting. I understand that like live in-game betting has been a thing for a long time on different websites, but I'm curious, has it ruined the way that you view sports now?
It's made me it's made me view sports and sporting as exploitive. You talked about exploitation in the sense of like, are they doing things that are even over and above? But I think like just like gambling, this there's a lot of industries that have arisen lately that are just exploitive in their very nature. You know, Gambling, OnlyFans, driving Uber where people don't understand the cost amortization of their car and are actually losing money for every mile they drive. They're not making any money. These types of exploitive industries continue to exist. And so I think it just makes me view it as like they're sellouts. All the things they said year over year about how they want to preserve legitimacy in the sport, all the things they said about how we're above the fray, we're clean, you know, we're we're above all these things, like with the Pete Rose example, among many other examples, like the ref in the NBA. But like now, it's like no, it's part of the actual sport. You saw the example. I think it was the Toronto Raptors, or one of the players,
Jonte
had to be
Porter?
removed. Yeah, like that's you think that's an anomaly?
No. Oh God, no.
That's part of a cultural norm that's changing. You can't tell a 20 or 21 or 22 or 23-year-old athlete like 24/7 gambling is great. It's the best thing ever. It's really important for our team that we have these relationships. But you're separate, right? You don't participate. You're not going to do any of this, right? No, that double standard is not going to exist. So it makes you wonder about even the legitimacy of the outcome.
Right. Uh, that is a humongous problem. Is the integrity of sports is also on the line as this industry continues booming. I remember covering a story, I believe it was the Iowa State football team and baseball team. And there is a rule in the NCAA that says you can't gamble on obviously your own team. You can't gamble on, I believe the bylaw says other collegiate sports, but you can gamble on professional sports, which also just struck me as being very odd that you're allowing, as long as they are of age, to gamble on, I think it was an Olympic sport. So if it's like MMA, boxing, they could gamble on it, which also just feels very weird to me because I get it. Like NIL is the new thing. And according to the Supreme Court now, schools are going to be able to pay a lot of these collegiate athletes directly. A big problem. But they're
Who's going to be the
allowing.
first collegiate athlete that's going to be endorsed by a sports book?
That's a great
What's going to happen?
question. That's a great question. I don't
That's going to
know.
be
But are they
that's
going to
going to
allow
happen
it?
for sure.
Can the NCAA allow that?
Who knows if they can or can't? That's the pervasiveness of what we're doing.
That's a great point that I actually did not think about. And they should not allow it, but it wouldn't surprise me, as cash is king, that they would enable it. And they could probably build a Hulu has live sports like roster and start building out all of these different college athletes to endorse gambling while saying you can't gamble on collegiate sports, but you could gamble on professional sports. So the anomaly thing, I think that is a humongous problem. And I don't believe Jonte Porter, as we stated, is a one off. Is there anything that the leagues can do?
Well, the leagues themselves should be advocating for a public health board. Remember what the the NBA was like during COVID, they're like, we're all about public health. We're all about doing things exactly right. We want to live in these bubbles, right? We're
Yes.
going to do all these absurd things for the fittest, healthiest, youngest men who have the least risk of a bad outcome. We're going to do all these things symbolically to communicate that we care about public health. But when it actually comes to public health and they're injuring people and causing people to lose their resources, lose access to their livelihood, and think about it. It's like I don't want people to think like sports betting is like, oh, you just lose some money. Well, yeah, you lose some money, but it also has gambling addiction has all these collateral consequences. Much more at risk of suicide, much more at risk of depression, much more at risk of other types of addiction like alcohol and drugs. It's a devastating. It has this cascading effect that creates devastation. So why aren't they advocating for public health? Shouldn't they be the ones doing it first? Don't they want to be consistent with the way they were in 2020 and 2021 and today? Like we're talking about young people who have, many, many years of a healthy life ahead of them that they could be pulled off course by sports betting. What do we want to do to protect them? And should we protect them? What kind of bubble are we going to create? Using the bubble of COVID that they did for the NBA. What kind of bubble are we going to create around our sport and around young people to protect them from gambling and gambling addiction?
Hmm. That would also coincide with them probably not putting sports books, as we already stated previously in this episode, within the confines of their stadiums, ballparks, etc. Two more questions for you, and I really do appreciate the time here and your insights. When you see really quickly on the TV screen, the text at the bottom and a quick disclaimer at the end, whether it is a radio spot or it is an internet spot, a YouTube ad, etc. How do you feel about that very, very, very quick ad read at the end that says, if you have a gambling addiction, call blah, blah, blah?
Yeah, warnings. Do warnings, are warnings effective? And we used to think like a warning is like the minimum we do, and that would work. This 1-800 number, the gambling addiction resource, and then some fine text, and you're good to go. But a warning doesn't mean it's effective. The purpose of those is to impact outcomes, and I will tell you that those warnings have not been formally evaluated to know that they work, that they persuade people who have a gambling addiction or gambling related problems to then seek help. There's no demonstration evidence there. I don't know of any, randomized control studies where they're actually evaluating different types of warnings. Like with tobacco products, for example, we know that a warning label in theory has an effect, but it's not just any warning works. It's actually the graphic warnings that show the consequences of smoking. Those have a tremendous effect on increasing the prevalence of people who themselves want to quit and make a quit attempt. Not the smoking is bad, like in small text at the bottom, with a number you could call. Like, so that's the difference. It's like, are we going to actually invest in doing things the right way? And I think what you're seeing in the industry is like the reason there's support for things like that. And we do that is because that's just the bare minimum. And so what I would say is like, what's the goal of a warning? And is that goal being achieved? And how should warnings evolve to be effective? And that's what we should be investing in.
Absolutely. I know I asked you about hopefulness previously. Do you have any optimism for the future within this industry?
I have optimism that regulators can step in and have a tremendous effect. I'm of the age to remember when the smoking prevalence, was greater than 1 in 4, and that was the norm. Like you went to a concert, you went anywhere, you couldn't breathe. Like you went to go to a bar and hang out with your friends, you couldn't catch your breath. And now that's totally different now, right? That's totally been almost eviscerated from our culture. Where, like, if you were to can you smoke on a beach, like in California, right? Like and not just because the regulations made it that way, but the regulations changed the culture, right? The culture shift where it goes like, no, I don't. This is not something I want to participate in, and I wouldn't want to violate cultural norms, but to behave in this way. And yes, people benefited from not smoking themselves, and other people benefited from reducing secondhand smoke exposure. But like the culture changed, and the culture changed through regulations. Beginning And it didn't start like with a national conversation. It doesn't have to be that Donald Trump tomorrow has to stand up and say this is his number one legislative agenda. It can start small. All that effect of smoking started with Berkeley, the city of Berkeley, banning smoking in certain public spaces and saying you couldn't smoke in these settings, like restaurants, parks, etc. And changing, and as a result of that legislation, it grew. It now went to larger cities like New York was one of the first large cities to implement legislation like that, and it grew to states, and it changed the culture. And I think that could happen here with sports books. I think one or two strong advocates for public health could step in and create regulations and create a test within a small area within a state to show the effectiveness of what we can do. And I think it will have an effect. And I will say, if we don't, right now we talk about the harms as anecdotal because it's so new. It's only been a few years since the NCAA court ruling that allowed legalized sports betting. What if, when the harms become more apparent, what are we going to do? Because now we're not really seeing them. And I think as those harms become more apparent, we'll be more likely to act. So I think there's two ways: experimentation, someone small taking initiative and doing something about it, in a city or a state. And then also, as the problem becomes more apparent nationally, I think that will engender a more national reaction. Our findings, they forebode what could be coming. And I think now there is actually some investment happening into research to understand the size and scale of the problem. And unfortunately, I think it's going to find it some damning evidence. And I think that damning evidence will then engender some more response.
I lied. I actually have one more for you. And I
Yeah, go
think this
ahead.
is always really important because folks like you devote a lot of time in their careers into these things. And I want to cover all the bases. Considering that you told me prior to when we went on that you've done a lot of media and you've done a lot of interviews, is there something that you've been surprised about that those in the media have not asked you about, or a part of the study that has not had a light shined on it that caught you off guard rather?
I think two things. I think one, the explicit danger of online sports betting was not fairly identified by a lot of the media, right? That we could actually distinguish the effect of when betting was made available online in states and see the effect of that was substantially greater than sports books or no sports books whatsoever. It was a step great effect. I don't think that got a stronger reaction, but I think the biggest reaction I was a little bit surprised of was defense of the industry. And I think that's because in media, we're trained, at least me, I mean, as someone who is civically trained to be a good political advocate, I was always trained to walk, to be debate, to have like an open mind, both sides, like here's the one side and here's the other side, and let's present both. And that's the way the media is trained, and a lot of political dialogue happens. But I think that whataboutism kind of surprised me, right? Because I felt like if you had substituted the words gambling addiction with e-cigarettes or with young people drinking and driving or with cannabis or some other drug, I think the reaction has been a lot more strong. I don't think there'd have been so much of whataboutism, and I was really surprised to see that because I don't see the media going and interviewing the Marlboro man to get his take on what should be done about tobacco. But we do that with gambling, right? We have these gambling organizations like the American Gaming Association, a lobby that exists to represents the sports betting industry, and we go to them to ask their insights on what we should do. And I was a bit surprised that that still exists, that whataboutism, that both sidesism. And I was a little shocked at that. And that people kind of reporters have a flippant attitude about, sports betting and what that means. And they don't actually think about it. And when you start to think about the effect it has on people, man, it's pretty heartbreaking.
Absolutely. John Ayers, thank you so much for the time and the conversation. I really appreciate it, and especially shining a light on something that I know, myself included, see as a humongous problem within an entire industry that we so dearly love. So thank you so much for your work and your time. I appreciate it.
Thank you for having me.